The SHIP mnemonic is used to remember common causes of euvolemic hyponatremia, where the patient appears clinically euvolemic but has a low sodium level. SHIP. SIAD, syndrome of inappropriate antidiuretic hormone secretion. The most common cause, characterized by excessive ADH leading to water retention and dilutional hyponatremia. H. Hypothyroidism. Reduced thyroid hormone can impair water excretion and lead to hyponatremia. I. Inappropriate water intake, psychogenic polydipsia or tube feeding. Excessive free water intake overwhelms the kidney's ability to excrete water. P. Primary adrenal insufficiency, Addison's disease, or psychogenic polydipsia. Cortisol deficiency leads to increased ADH release and impaired free water excretion. Notes: in clinical practice, managing hydration in patients receiving tube feedings includes ensuring that water intake is balanced with electrolytes to avoid this problem. Careful monitoring of serum sodium levels and adjustment of water and electrolyte intake is critical to prevent hyponatremia. This is especially problematic if the patient already has compromised kidney function or conditions like Addison's disease or SAADH, where the body is already predisposed to retaining water. In patients with compromised kidney function or conditions like Addison's disease or SAADH, careful management of hydration and electrolyte balance is crucial, especially when administering tube feedings and performing flushes between feedings. Using NS and isotonic solution, 0.9% NaCl, for flushes after tube feedings can help ensure that the patient's sodium levels remain stable by preventing the dilution effect that might occur if only water were used for flushes. This is especially important in patients who are at risk for hyponatremia, like those with Addison's disease or SAADH, who already have impaired water excretion and a tendency to retain fluid. In patients with SIAD or renal impairment, implement fluid restriction might be needed to avoid fluid overload, which exacerbates hyponatremia. Careful monitoring of urine output and overall fluid status can help guide these restrictions. The VD.DART mnemonic helps remember the common causes of hypovolemic hyponatremia, which occurs when there is a decreased volume of extracellular fluid along with low sodium levels. V. Vomiting, loss of fluid and electrolytes, particularly sodium, from persistent vomiting can lead to hypovolemic hyponatremia. D. Diarrhea, similar to vomiting, prolonged or severe diarrhea causes loss of fluids and electrolytes, leading to hypovolemia and hyponatremia. D. Diuretics, especially thiazide diuretics, which increase sodium excretion in urine and can cause hypovolemic hyponatremia. A. Addison's disease, a deficiency in aldosterone leads to sodium loss through the kidneys, causing both fluid depletion and hyponatremia. R. Renal tubular acidosis, in this condition, the kidneys lose sodium and water, contributing to volume depletion and hyponatremia. T. Trauma, or third space loss, after trauma, surgery, or burns, fluids can shift into the interstitial space, leading to fluid loss from the circulatory system, which can cause hypovolemic hyponatremia. CNC mnemonic helps remember the common causes of hypervolemic hyponatremia, where there is an excess of extracellular fluid and low sodium levels. C. Congestive heart failure, CHF. In CHF, the heart's inability to pump blood efficiently causes fluid retention, leading to dilution of sodium in the body and hypervolemic hyponatremia. N. Nephrotic syndrome. This kidney disorder causes protein loss in the urine, leading to low albumin levels and fluid retention, which can dilute sodium and cause hypervolemic hyponatremia. C. Cirrhosis, liver disease, particularly cirrhosis, can lead to fluid retention due to impaired liver function, which results in ascites and dilution of sodium, causing hypervolemic hyponatremia.
Signs and symptoms associated with hyponatremia or Addisonian crisis. Stupor/coma. Anorexia, nausea and vomiting. Lethargy. Tendon reflexes decreased. Limp muscles weakness. Orthostatic hypotension. Seizures/headache. Stomach cramping.